So Kate is a 15-year-old girl presenting for the 4th time in 6 weeks with recurrent bouts of high fever, abdominal discomfort, sore throat and nausea. She has generalized fatigue, decreased appetite and has lost weight. Her mother thinks she has tonsillitis again. Select 3 of the most likely diagnoses in the following list. Okay, so basically, this is really what an extended matching question looks like. You will have 15 to 20, sometimes even more options, so it can be a little bit daunting. So one suggestion with extended matching questions that I will provide is really to just read the question and think yourself of what the answer is before you go to the options, because the options can sometimes confuse you. So think of the answers and then look for the answers in the list. That will not confuse you, and also it will mean that you can get through the questions faster because you're not reading through all of the other random questions that are in here. So people are saying, yep, okay. So this is a question from a practice exam that I took at the RACGP has given out. So yep, so most people are writing all the same stuff, which is right. So her symptoms really do. They could be EBV, CMV, or leukemia. So that's what most people have written. So that's great. So okay, and I won't explain why. Yep, you guys can learn that yourselves, I guess. Okay, so it is a written question. So we've got Olivia, a 6-year-old girl, presents to you with fever, lethargy and vague left upper quadrant abdominal pain. On examination, her temperature is 38 degrees Celsius, her respiratory rate is 40 breaths per minute, and her abdomen is soft and non-tender. Her chest is clear to auscultation. So the questions are, there are 2 of them. So, and on the computer system, you have space to type in your answers under each section. So it will ask you, what are your most likely differential diagnoses? List up to 3. And what are the appropriate investigations? List up to 2. So, okay. So basically, what it asks. So what it's asking is it's saying that you need to list up to 3. So you don't need to give them 3 if you can't think of 3, but don't give more than 3, otherwise you'll lose all those marks. Yeah. So what do people think about the first question? Yeah. Okay. All right. So basically the first question, the answers were left lower lobe pneumonia. Which someone was specific in saying, so Samsia said that, and also your urinary tract infection. In terms of the third diagnosis, that's not as clear, but you could write a viral upper respiratory tract infection, which would also be right. Yeah. Okay. So in children with temperatures, a urinary tract infection always needs to be ruled out, basically. So that's an easy one to always write down. Okay, and so what are the appropriate investigations? List up to 2. So this is easy if you know what your differential diagnosis is. Yeah. So it's going to be an MSU and a chest X-ray. So that's right. Those 2 are the investigations, because those investigations are trying to find out what the diagnosis is. So there always needs to be a reason for what you're testing.